So I'm Gwen. I'm a student at Utah Tech University. I'm in the dental hygiene program. And today I'm just going to be doing a presentation on oral health and how it relates to your guys' clients, which is the pregnant population. So I hope you guys learned something and are able to integrate this into conversations with your clients. Okay. So before we start, just really quick, I'll have you guys scan this QR code. And this is it's 8 questions. It's a pre-test, and we'll actually go through the same questions at the end to see what you guys have learned. So yeah, I'll give you guys a couple minutes to do that. Allie, you too? Just kidding. Yeah, I'm just kidding.
I don't know.
Okay, perfect. While you guys are finishing that up, I'll just go ahead and start. So to start off, I have a few facts. So gingivitis, which I'm sure most of you have heard about, but we'll talk more about in this presentation. It's the earliest stage of gum disease. And 60 to 75% of pregnant women present with gingivitis. And that's problematic because gingivitis is linked to numerous pregnancy complications, which we'll get into. Alright, so just some goals for this discussion, this presentation is we're going to talk about what pregnancy gingivitis is, what causes it, best practices for oral hygiene for pregnant women. We're going to talk about oral health and how it relates to systemic health, and also how to integrate discussions with clients about oral health. Alright, so first we're going to talk about pregnancy gingivitis, and you actually can go to the next one. So, gingivitis, its primary cause is dental plaque or biofilm not being effectively removed from the tooth. So as you can see, I just put a little graphic, that's a healthy tooth, and next to it is a tooth with biofilm that wasn't removed, and you can tell the gums are inflamed. And certain factors that we'll talk about and during pregnancy accelerate this process. So you can go from health to disease, and that progresses quicker. Alright, and so here's just some signs and symptoms of gingivitis that your clients could monitor themselves. So you'll see red gums, they're going to be swollen and tender, and they'll also bleed easily. So if you're flossing and brushing and your gums are bleeding, that's not normal. So that's a sign that a disease process is happening. So like I said, gingivitis, it's the first stage of gum disease. And gum disease is also referred to as periodontitis. Those words are interchangeable. You've probably heard them as either. And with proper management, gingivitis is reversible. But periodontitis, which we'll talk about, is irreversible. So you can go from health to gingivitis back to health, but you cannot go from periodontitis back to health. Alright, so like I said, left untreated, it can progress to what we call periodontitis, and periodontitis is irreversible. And it's characterized by basically uncontrolled inflammation. So the body's response to inflammation is to get away from that bacteria. So basically the alveolar bone, which holds the teeth in, will start to recede in periodontitis. So if this is like the tooth and that's the alveolar bone, which is just the jawbone, it will start to recede, and that can lead to tooth loss and all sorts of other problems. So yeah, and a couple ways that we diagnose it in the dentist office is we look at x-rays, look at the bone level, we take our periodontal probe, which you guys have all had your gums measured, we do that, and just some other things. So yeah, and I thought this was a good graphic just to kind of show the process. So that's a healthy tooth, healthy gums are pink, and the bone is holding the tooth in. Then gingivitis, you can tell it's inflamed, but the bone levels are still normal and stable. And then periodontitis, you can tell the bone is starting to recede and the tooth is coming away from the gums. Alright, so there's a lot of lack of awareness within the pregnant population of pregnancy gingivitis and what could happen subsequently. And this study is actually one that I found in Utah. It said that around 43% of pregnant women had heard of pregnancy-induced gingivitis, but they didn't know the consequences of it. And another 32% were completely unaware of pregnancy gingivitis. Alright, and just to reiterate, so that's an issue because 60 to 75% of pregnant women have pregnancy gingivitis, and there just is a need to educate and bridge the gap so we can achieve higher health literacy. Alright, so, and this part is just like a little discussion. So, what do you guys think or have heard of any concerns or misconceptions pregnant women have had, like, about receiving dental care during their pregnancy? Like, can you guys think of any? If not, it's okay, we'll go through it.
I haven't really heard any. I'm really curious.
Yeah.
Okay, I don't think they really think about it.
Yeah, I think you're right. Yeah, definitely. Alright, you can. Alright, so there are a lot of misconceptions about like the safety of it during pregnancy, and yeah, I think a lot of people just don't really think about it. There's like other things they are worrying about during that time, but also, you know, not even just the pregnant population is misinformed about dental care during pregnancy, but even other healthcare providers. So I found that 73% of gynecologists believe that dental x-rays are unsafe during pregnancy, and 59% believe that local anesthesia is unsafe for women during pregnancy. And in Utah, 43% of pregnant women are not receiving dental care during their pregnancy, which is probably largely to do with misinformation or, yeah. Alright, so current research is pretty clear that dental care during pregnancy is safe, so including like, you know, diagnostic procedures like x-rays, cleanings, even some restorative work, and it's safe and effective during pregnancy, like it's encouraged. I will say the second trimester is like the safest. It's generally safe throughout, but it's the safest. So if you went in your first trimester and you needed x-rays, the dentist would probably have you wait until your second trimester. But overall, you should be getting checkups. Just to prevent, you want to prevent rather than treat. That's the main takeaway. So fluoride is also another one that has been questions for its safety, not in general, but especially during pregnancy. And it's actually in its recommended doses, it's encouraged because basically what happens with fluoride is it displaces a bond in the outer layer of the tooth and makes a stronger one so that it's more resistant to cavities. So it's actually really important during pregnancy because I don't know if you guys have heard of it, there's a misconception that during pregnancy, pregnant women are more susceptible to cavities because the baby will leach calcium from the tooth, which isn't true actually. Usually, there's a couple things that could be happening. So your eating habits are usually different during pregnancy, so that could be one factor. You're eating more, maybe some more sugary foods. So it's really important to, have fluoride on those teeth. You want to prevent, basically, before you have to go in and get a restoration. So again, it's just really important to prevent. And I also wanted to add sodium fluoride is probably the best, what I would recommend to a pregnant woman. There's a bunch of different fluorides in toothpaste, like stannous fluoride, but sodium fluoride would be the most beneficial for them because during pregnancy you have like, you're nauseous, you might have morning sickness, so you want to balance that pH in the mouth. So yes, so we'll go through some best home care practices. So as far as oral health practices or measures, what do you think would be most essential during pregnancy to maintain oral health?
Obviously, brushing and flossing.
Yeah, for sure. So just to reiterate, it's dental plaque or biofilm. It's bacteria left on the tooth, and when it's not removed, it causes inflammation and could lead to further disease process, get into periodontitis, and it's a driving factor for oral disease. So during pregnancy, it's problematic because if you're not effectively removing it, if you just have even a little biofilm left on your teeth after brushing regularly, your body might not have a response to that. But during pregnancy, we'll talk about the hormones that play into it, but your body creates an exaggerated response. So gingivitis onset is faster. Your body will react to it quicker. So the most important thing for pregnant women is just making sure they have a really good oral home care routine. So brushing twice a day, flossing once is ideal for most patients. And then I also want to note that an electric toothbrush I would recommend that just because it's shown that they remove plaque a lot more effectively than manuals. And then not only brushing twice a day, but brushing twice a day correctly is going to be important. And before hygiene school, I wasn't even brushing correctly. So you want to angle the brush just 45 degrees to the gum line, and you want to use small circles. I also tell people to stay on the tooth for a few seconds before moving on to the next one. And then just some interdental aids I wanted to show. So the ideal for most patients is using string floss, but a lot of people are not compliant with using string floss every day. So about 30% of people are flossing every day, so that means 70% are not. So it's just important that every day something is going in between the gums, especially during pregnancy when you have such a exaggerated response to biofilm. So I just showed a picture of interdental brushes as an option. They have like little bristles on them. And then water flosser, and I'm sure you guys are all familiar with the floss picks. Alright, so yeah, just to sum up this first section before we move on. So gingivitis is the first stage of gum disease. If it's not treated, it can create, the process will go into periodontitis, which is irreversible. And there's lots of misconceptions around pregnancy or dental care during pregnancy, so that's a barrier to care. And the best way to treat gingivitis or prevent it is through awareness of it. And then, any questions about this section before we move on? Yeah.
Is the water floss, is that as effective as like normal flossing?
So I think technically like regular floss is going to be most effective, but if that's what you're going to use over floss, then yes. And water flossers, they're nice because they just get deeper into that like pocket where the gums are. So I think they're effective from all that we've looked at school. So yes. Alright. Okay, so now we're just going to talk a little bit about oral health and how it relates to your overall health. And actually you can skip this one. Yeah, perfect. So during pregnancy, as you guys know, there's just a dramatic rise in sex hormones, namely progesterone and estrogens. So what that does is it alters the immune response, and there's also a significant shift in the oral microbiome. So there's a dysbiosis there, and we'll talk about what happens, but there's an exaggerated response to that biofilm. So, and just looking further into it, saliva samples, they show that there's that dysbiosis, and pathogenic bacteria are able to thrive really easily during pregnancy. And I just listed a few, but Porphyromonas gingivalis is a big one that is going to contribute to destruction of the tissues in the mouth and some other things. And I thought this was interesting. So I saw this study that was talking about how the oral microbiome is linked to the placental microbiome. I thought that was kind of interesting, and just another reason that you want to make sure you're keeping up on oral health because of that connection. Alright, so like we talked about, just to reiterate, so it's that change in the oral microbiome, those hormones, that in a susceptible host that cause that really fast destruction if it's left untreated. And so that uncontrolled inflammation is what is going to destroy that bone and cause all kinds of issues if you're not on top of it. Alright, so this is just a little case study that we'll go through. and then we'll discuss it. I'll ask you guys what stands out to you or what you would be concerned about, and then we'll talk about it. But so Sarah's a 29-year-old pregnant woman in her second trimester. She presents with gingivitis, so swollen, inflamed, bleeding gums. Upon reviewing her medical history, she indicates being diagnosed with gestational diabetes, and during her assessments, her vitals indicate a blood pressure of 135/86. So is there anything that you would especially be concerned about in this case?
The combo of diabetes and gingivitis is concerning.
Yes, yeah, definitely. Okay. And you're so right. So with gestational diabetes or diabetes in general, you're 3 times more likely to develop gum disease. So, and we often see that, like in clinic, we've seen a lot of, it's a rapid progression of that disease. And that's because of a few reasons. So the elevated blood glucose levels in the blood actually is a food source for the bacteria, so they're able to multiply really quickly. And also diabetics, I'm sure you guys have heard, but they have delayed healing, so your body's not able to fight that off as effectively. And then on top of that, if she's pregnant, her immune response is also altered, so that's really concerning. So in this case, if the glucose levels are not properly managed, we can expect to see severe gingivitis, and which could quickly progress into periodontitis. So you want to make sure these patients are managing their diabetes correctly. So, and then cardiovascular disease is another concern. So gingivitis and periodontitis are inflammatory diseases, and so is cardiovascular disease. So one influences the other. It makes either or worse. And also bacteria is able to travel through the blood and cause more inflammation systemically and just cause damage. And like we talked about, so Porphyromonas gingivalis is one of the pathogenic bacteria that is seen in the oral cavity during pregnancy, and that's also linked to cardiovascular disease. Alright, so as far as pregnancy outcomes, poor oral health has been positively associated with preeclampsia, preterm birth, and low birth weight. And that's because with gingivitis, your body's response is to release prostaglandin E2 to fight it off, and prostaglandin E2 is also responsible for vasodilation, and it will indirectly induce labor. So if you have poor oral health and you have gingivitis happening, you could potentially put yourself into labor too early, which is kind of crazy. So just to recap, so individuals with diabetes are 3 times more likely to develop gum disease. Poor oral health is associated with preeclampsia, preterm birth, and low birth weight. And cardiovascular as well as diabetes have a bidirectional relationship, so one influences the other. So you want to manage both. Alright, so any questions on that?
What would be the risk, I guess, if a pregnant woman has the
periodontitis or
that one. The first one.
Periodontitis. Okay.
And she doesn't get treated. What will happen to her teeth?
So your teeth. And I've heard people say oh, it's normal to lose a tooth during pregnancy. It's not. So that's what happens is if it's untreated and if you're not, have a good oral home care regime and you're not going into the dentist so they can help manage that, you could potentially lose teeth. And same thing, your body is also going to send out prostaglandin E2, and you have the same risk of preterm birth, preeclampsia, all of that.
So it's the early symptoms, is that painful besides the swollen gums?
It's actually not, and that's why a lot of people think it's not a big deal because they're like, oh, my mouth doesn't hurt, but periodontitis won't hurt. But it's almost like you can especially in the pocket, you can almost think of it as like an open wound. So it's just because you can't see it and you don't really feel it. But if you had like an open wound on your arm, like you would go get it treated. But since you cannot really feel it or see it, people don't think it's that big of a deal. So yeah, it's kind of crazy.
Thank you.
All right. So lastly, we'll just talk about integrating oral healthcare discussions with clients and why that's important to do. Alright, so collaboration is just going to be the most effective way to reach the most amount of people, and it's really important that healthcare providers and community leaders like you guys bridge the gap for health literacy. Alright, so when you're thinking of having a conversation with clients about their oral health, what are some barriers or challenges that you think might arise?
Price. I mean, you know, everything's expensive, and they're getting ready to have babies, so it's kind of.
Yeah, like on the back burner. That's where I'm at.
They're busy.
Yes. Yeah, for sure. So, yes, and I also thought maybe time, because you guys, are trying to get so much done with them in that appointment that you might not think to talk about this. But one way I thought to solve this is just integrating this, oral health discussion with other health history things, because it's, connected, so it's important to address both. So while you're asking some of those other health questions, you might want to incorporate that. So, and then confidence, because it can be a little intimidating to discuss something that you're not really sure all the answers to. So, just some things, even after this presentation, you could talk about is just the importance of preventing gingivitis and what it could do, like what complications could arise if you don't. And so just talking about, brushing twice a day and flossing, and then going in to see the dentist, and if they and you can address misconceptions like as they arise. If they say that they're worried it's going to cause harm to the baby, you can address that and talk about how it's easier to prevent something than to treat it, and that's going to be more invasive if they leave it. And yeah, it's okay to not have all the answers too. So, and just something I thought of is it's hard to even start that conversation. So you could even say we just attended a presentation about oral health and pregnancy. Do you mind if I share a couple of things I learned? I thought that would be a good way. So, and some questions, you could inquire about what their habits are for getting professional dental care if they're going in every 6 months. And then you could go from there. You could talk about how it's important to be going every 6 months and getting checkups. And just encouraging them to go in for an exam just to make sure everything's alright. And then you can also ask about their home care routine and talk about, the ideal of brushing twice a day, flossing once. And something we do in the clinic is just set goals with our patients. So you could utilize that. You could say, if they've been if they're I haven't been to the dentist in a few years, you could say, okay, can you make it a goal that you go in, explain what could happen if they're not maintaining oral health, and say, would you want to go in every 6 months, and then we can check up on it when you come back, just see how it's going. And always offer positive feedback of what they're doing right for their health. And education is the biggest thing too, just so that they're aware. And then in your position, a really big thing you can do is referring the client out to dental professionals. And people often are more compliant when you give them physical referrals. You could give them address or phone numbers of local dentists, or especially with price, you could give them the information for the Utah Tech Dental Hygiene Clinic, because that's often, it is cheaper than going to the dentist. So, and a lot of people don't know about that. So I think it's important that we all work together so that people are able to take care of their health and have those options. So you guys are just all in a position to make a really big difference. in the pregnancy outcomes through discussing oral health. Yeah, and you guys already make such a big difference. This is just one more tool to make sure clients are having successful, healthy pregnancies. Alright, so yeah, just that's a little summary of what we talked about. Do you guys have any questions about any of this?
Do you have any brochures or anything on the?
No, it's funny. I did think about bringing it, but I didn't. And I can drop some off actually, because yeah, I feel like a lot of people don't know about the clinic.
Yeah, we don't have anything on it.
Yeah. Okay. Yeah, we have a little brochure, so I'll bring them over. I think they have like the prices on them and everything like that. So, but it's pretty discounted for, and a lot of people we have. Well, I don't want to say everyone qualifies, but we have a grant. So if you're low income, it could potentially be free. We don't usually tell people that just to not get their hopes up, but
you can just tell them it's at a reduced price.
yeah. So that's really helpful.
So is it like a one-time visit, or do they come every 6 months?
So yeah, the only times we're not there is the summer.
And the winter, so it's like.
Well, yeah, in December we're not there, but so yeah, so it goes by the school semesters. But yeah, they can come in as they can come in, whenever they want, and yeah, so.
So even some patients even say they want to come like 3 months, so sometimes people are coming in sooner than the 6 month recall that we
Yeah.
do.
And then like you just keep their records and it's like
Yeah,
a checkup every
exactly.
time. That's cool.
Yeah, no, it's really cool. We have a dentist on site and everything, so it's really good. And then we have the U of U dental clinic next door to us, actually, like right across the hall, and they can do like restorative work and all that stuff.
So we kind of work together to send patients to like
Yeah. So it's really cool.
And then you were saying that second trimester is like the safest for pregnancy or dental
Yes.
care.
Yeah.
Are X-rays like permissible or like allowed during second trimester, or are X-rays just like not?
Yeah.
used?
They're definitely safe during the second trimester. Like that is just the safest for any dental procedure. But technically it's generally safe all trimesters.
Okay.
But if it's more of like an elective thing, you might want to wait. But if it was like, if you had an abscess too or something crazy, yeah, you'd want to, they would still take x-rays and all that your first or third trimester. But yeah, a lot of people, from what we have learned, don't think it's safe. So that's kind of why they won't get care. But yeah.
Well, and X-rays nowadays, I mean, you don't even have to put that heavy weighted
Exactly.
thing on anymore. It's just like a
Yep.
beep.
I know, and I didn't know this either, but we learned, I think it was like, you get the same amount of radiation from watching the TV for 30 minutes
Or like
than getting a full full mouth series of x-rays.
Another reason not to eat bananas.
Yeah.
Yeah. So, anyway, any other questions?
But if somebody has the gingivitis and it's with interperiodontitis,
Yeah.
and so there is a lot of infection in there,
Mhm.
is that still safe to treat that while they're pregnant? Just because of all the bacteria that's being stirred up as they do the
Yeah.
planing and
Yeah,
all
that's
the
a
cleaning.
good question. Yeah, it's a good question. So, yes, it is safe, and I should explain more too on the local anesthesia. So, I don't know if you guys know, but when you have periodontitis and you're like doing the deep cleanings,
I'm sorry.
you're good. I'm like, sorry. Oh, you're fine.
I guess it's after this. So can we bring right now?
Oh yeah, can you bring them around back? We've got a presentation. No, you're fine. Okay.
Just like, come sit. But yes, so with some patients you will pre-medicate, but I don't think that's applicable during pregnancy. So the pre-medication is if someone had like an artificial heart valve. It's so if they're at higher risk for that happening, like bacteria getting to the blood and causing big issues, then you would pre-medicate with antibiotics so that doesn't happen. But as far as I know, it is safe to do. Like, do you have anything, Ellen? I don't know for
Yeah,
this,
I
but
think it's better, I guess, to remove the infection and inflammation, because if it's something negative that's causing the mouth can affect the baby, so it's better to probably treat it
yeah,
before it
until it
extends to already, 6 months, 9
Yeah, that's a good point. And yeah, like we were talking about, like the tooth can abscess and you can have that infection at the root of those teeth, and that would be more problematic than cleaning and getting it taken care of. Yeah.
And then I've heard a couple different time frames of when to replace your toothbrush, but when do you guys think your toothbrush should be replaced?
I think I replace mine every couple months, but a good indication of that too is
New bristles.
yeah, if your bristles are splaying out at all. Well, first of all, if it's splaying out before a couple months, that means you're brushing too hard, which is even more, that's a problem because that can cause recession and your gums can start to pull away. So I would say every couple months is like ideal.
Another thing to keep in mind is if you get sick. Like if you get sick, it's probably a good time to maybe switch it out because there's probably still some bacteria on the toothbrush if you're constantly sick.
Yeah, that's a good point. Anything else?
Such good tips.
Yeah, alright. Well, thank you so much. I hope you guys learned something and you're able to talk about this with your patients. And yes, and then really quickly, so we'll take the same quiz again and see. Yeah.
Another thing you could possibly add is just like after steps of like if someone vomits or throws up, you know how that affects it.
Yes, I actually meant to talk about that during fluoride. So, yeah, that's a good point. So if during pregnancy you're having morning sickness and you're throwing up, a lot of people want to brush right afterwards, and that's a problem because basically that's just pushing the acid further into the tooth. So what you want to do instead is actually rinse your mouth out with some water before you brush. So, because it can be tempting just to brush it.
Rinse with like a tablespoon of baking soda and water just to help neutralize the pH of the mouth, and then maybe wait because you're actually supposed to wait like a few minutes, like 30 minutes
before brushing it.
Yeah.
Yes. Yeah, and that's another reason I was talking about sodium fluoride, is that just helps neutralize the pH in the mouth.
I still think I got a couple of them wrong.
Yeah. That's alright. Okay, perfect. Alright, well, thank you so much, you guys.
Thank you.
Yes.
Thank you.